Hi.
Hey everybody, welcome to Knock Knock Hi with the Glaucomfleckens. I am Will Flannery, better known as Dr. Glaucomflecken.
I'm Kristen Flannery, also known as Lady Glaucomflecken.
Well, the time has come.
It is. It's time.
It's
you
time,
need to face your fears.
It's time to talk to a dentist.
That's right.
We've, for almost 2 years now, we've been doing this podcast.
Is that true?
Yeah, almost 2 years. Not a single dentist.
Wow.
The accusations were coming in that I am an anti-dentite.
Yeah, from me in particular.
But I am not, and I am not against dentists, even though I portray them as mafia bosses in my content.
Yeah.
I do appreciate what they do because they gave me a decent looking smile. I had the braces. I did the thing.
Well, our orthodontist a type of dentist?
Oh, I thought you were going to quibble with me on my decent looking smile.
Oh.
I think it is.
Yeah,
the teeth are relatively straight and mostly white. I'm getting a little coffee stains going on.
Yeah.
I think whitening is in my future.
Yeah.
At some point.
You're not going to like that. I have to warn you.
Why? Don't you just put a little stuff on it? That's better than the scraping.
It makes my teeth feel sensitive. Like the stuff does.
Oh man, I don't like that.
But maybe you'll be different. I don't know.
Okay. Anyway, but it's the scraping and the and the poking,
the pressure,
and all the. But anyway,
are you gonna have a vasovagal response?
I'm not. I'm gonna be fine.
Okay,
be fine. But we did it. We talked to Dr. Humie.
That's right.
So I came across this guy on TikTok. His very high production quality, which we learned he films all his videos just with an iPhone, which puts me to shame because you can get that kind of production quality. Then I have no excuse. But anyway, he does great content, really funny content. And you know how much of a sucker I am for medical funny content people.
It's true.
And so it was great talking to him. Learning a little bit about dentistry and covered a lot of topics. I feel like we could have touched on a lot more.
Yeah.
There's so much I need to learn. It went fast.
I felt like we had a lot left to say.
We might try to collaborate down the road though.
Yeah, that would be fun.
Eyes and teeth are not as different as you would think. I did not have the courage to talk about the term eye dentistry with him.
What if your eyes had teeth? Or your teeth.
Well, they technically can if you have what's called a teratoma. You can get those in your orbit.
That is horrifying.
It's like a tumor that has multiple different embryonic tissues in it.
Yeah.
Including sometimes teeth.
And are they formed?
They're not like usable teeth. Like you can't take it from the tumor.
Sure, but you could see that. Oh yeah, that looks like a tooth. Oh
yeah, it's tooth.
Oh.
Tooth City. Yeah.
Well, that's horrifying. It really is.
Not only that, but there is a type of keratoprosthesis that uses a tooth. Now, it's not used as much anymore.
What is a keratoprosthesis?
So it's a artificial cornea.
Okay.
And there are certain really, really bad diseases that cause lots of scarring over the cornea, so much so that you can't do a normal corneal transplant. You have to do a special transplant that has metal in it. It's a prosthetic cornea, which we don't use very often.
Mm-hmm.
So people that have had bad chemical injuries or Steven Johnson syndrome, it's so hard to say that, SJS, other types of diseases that cause horrific scarring over the cornea, you can't do a normal transplant. So you have to have a prosthetic. And one of those prosthetics historically has had a tooth in it. Usually it's the patient's own tooth.
As always, I am sorry I asked.
Anyway, we're talking to Dr. Humie, and you should check out his content on TikTok and on Instagram. It's really, really well done. He gets his whole staff involved, and
it's very positive. It's positive feeling, it makes you happy.
And even better, it's respectful.
Yeah.
For pay so much. It's not the type of medical content that makes fun of patients in any way. And so it's just very well done. I really admire it and appreciate it. And so we talked to him about all of that and his process and content creation and dentistry and teeth and being scared of going to the dentist.
Mm-hmm.
Let's
do
get
you
to
feel better?
I do. No. No. I really,
Are you any more likely to go get that dental exam that you're overdue for?
I am overdue, and I will go. I don't have no time.
Are you going to go at the same time you get your eye exam?
No.
Because I'm starting to think neither one of these things are ever going to happen.
I will go. I will go to the dentist again. I will say it does feel easier when you go to the dentist like every 6 months versus waiting like 2 years. It's just, it's an easier time.
Right. Well, and they probably have less work they have to do on you.
But I'm really good at like dental hygiene. Like I floss every night. I brush. I use the mouthwash. I do everything I can to keep my teeth tip-top shape.
Yes, but there is a reason that we still need to go to the dentist every 6 months, even when we do those things.
Okay. All right. I'll go. I promise.
Okay. All right.
All right. Let's talk to Dr. Humie. Today's episode is brought to you by DAX Copilot from Microsoft. To learn about how DAX Copilot can help you reduce burnout and restore the joy of practicing medicine, visit aka.ms/knockknockhi. That's aka.ms/knockknockhi. All right, we are here with Dr. Humie. Thank you so much for joining us. Can I just say that you are our first dentist on the pod?
I was actually going to ask that because I was going through previous interviews. I'm like, okay, I think I'm the only dentist on this podcast. So I'm honored, actually.
Yes. It is long awaited. We have been trying to do this for a long time. So we are very happy to have you.
Yeah,
Thank
well,
you.
I mean,
I'm
I
very
knew
excited.
exactly the dentist that I wanted to have on whenever I saw your content. And it's on TikTok. I wanted, let's just start there because the production quality is outrageous.
It is, yeah.
Thank you.
So how are you doing this? I assume you have to have a background in some kind of, video editing. I don't know, video making. What's going on here? How are you doing this so well?
Yeah, I'm actually doing everything on my phone, which everyone gets surprised when I say that. But as far as background or, education in film, I don't have that. It's basically just experience over time. I've been doing this.
Okay, now you're making me look so much worse. As I have no excuse then. You're just doing it on your phone. What's going on? What app are you using? Help me.
Okay, here's the thing though, because content nowadays, as we all know, it's about storytelling and relatability. It's really not about equipment anymore. So, the production aspect of it is fun. It adds that nice touch to it. But it's just the phone. I've been doing this since I was a teenager. And I think I just grew up loving film. And when I used to, rent DVDs to watch movies, they always had this extra DVD that had all the behind the scenes, all the B-roll.
Yes, I loved that one.
Yes, how they shot the different, sequences, action sequences.
Yeah.
I was nerding out when I watched those stuff. So yeah, it's just experience over time and just kind of.
I feel like that's gone away with. It's like the death of physical media now. Like the poor kids growing up, and like our kids, they're not going to know what behind the scenes.
I know. I always loved the commentary. I don't.
Yeah.
Where do you
DVD
even find that anymore?
You can't beat DVD commentary.
Yeah.
You
watch the movie and then you watch it again with the commentary on. It's just standard.
And now it's dying. It's unfortunate.
It is. I used to rent those, and I also used to rent movie soundtracks from like the public library. When I discovered that was a thing, I was just, it was like a kid in a candy store. I was like, wait, you could do that? So I would, I used to get soundtracks to like The Lion King, The Dark Knight, Batman movies, and just listen to the music only for hours.
Yeah, well, the Jurassic Park soundtrack has been stuck in my head for 30 years.
Yeah,
like it's just like
it's
burned in there.
That's good.
It's iconic.
That's a good one. And this doesn't surprise me because your use of music in your videos is great. And I could have the way you film it, like you do a really good job with the editing and everything because it really does seem like you have several cameras set up like in your office. And so it's I don't know. I take a lot of shortcuts in I want to be recording for as little time as possible because I don't know, maybe my attention span just isn't what it used to be. But and so I film everything in the TikTok app for the most part.
Wow. That is actually impressive to me because when I open TikTok, I'm like, I don't know what any of this is. I still do the old fashioned, editing software on the computer and just
you
upload
do?
everything. Cause I'm like, all these apps nowadays, I don't even know how to use.
Okay, well let's have this be a little test here. Like how long does it take you to like film to finished editing? Like what would be your average amount of time?
Depends on the video. I think anywhere from 2 maybe to 4 hours. Depends on how involved the video is, how much action, how long
that's
it
pretty
is.
Fast. That's
Yeah,
actually faster.
you kind of develop a formula over time. When you do this for a while, you kind of already in your head, exactly how you want it to look. And so it's mainly just about cutting and splicing based on your vision. It gets faster with time.
No, I totally agree. Like for me, the longest part is just the script writing. Like once I have the script written out, I can, because I film and edit in the TikTok app, I can like knock it out in like 30, 45 minutes. So it is faster to do it that way, but there's not as much of the features, the soft focus stuff that you do, the quality. Cause I need to figure out what kind of camera. I mean, you said you're using your iPhone camera.
Yeah, the iPhone.
Is it just like portrait?
I'm gonna guess it's cinematic mode.
Cinematic mode. Yeah.
There you go. Cinematic mode. You got the professional there. She can help you.
I know.
All right, but
he won't let me help.
But like TikTok, it softens my features, and so I look like 15
that's
years
really
younger.
all about vanity because he wants the filter. Right.
Honestly, I don't blame you because I've had moments where in the middle of editing,
I don't blame you. Look at your face.
No. I don't blame you because I want that too. Because I'm in the editing, I'm looking at myself and I'm like, oof, I look rough that day, or like my hair's all messed up. Like, you can see all my pores, but I'm like, whatever. I can't do anything about it.
Guys, lighting.
Yeah,
lighting is a filter.
I know. Unfortunately, medical offices aren't designed for like
horrible
lighting and filming.
Yeah.
Honestly, you walk into a medical office with the lighting, it looks like you're about to enter like a interrogation room or something. Yeah, it's bad.
Oh, you think a dental office is bad? Try going to an ophthalmologist's office.
Yeah. Oh, it's all in the dark.
Where it's all dark. Ooh. It's horrible. I can't film. I've done a couple of videos in a couple of our offices, and it's always a struggle. And I had to stop pretending I'm in an ophthalmology office.
Now he just does it in a bedroom.
Yeah, so it's like the production quality has declined. But what I'm impressed by you as well is how you get your staff involved.
Yeah, that is so fun.
So honestly, let's talk about that.
I've been very blessed, but also it takes a little bit of time to warm up the staff to it. I always say I've been blessed in being surrounded by people who just like to have fun and kind of let their creativity out. And I think the hard part is the initial aspect of it. Once you get someone in on the video and they see how fun it is, they see themselves, on the Instagram page, they see the people's reaction, they get excited and they're like, all right, I got over the hump. I'm ready for the next one. And now staff just give me ideas, we should do this, we should do that. So I think it's creating a fun culture in the office, fun atmosphere. A lot of it is also directing them what to do. People think I work with actors. Literally, people say that all the time. Like, oh, you just hire actors, or if you want someone to work in your office, they have to say acting on their resume. And I'm like, not really. I just tell them, just smile here, say this line, give me a little bit more emotion there.
As if you have the time, like you're gonna go out and find actors to come into the office. Like you got to see patients too. It's
correct.
Yeah, that's what I'm wondering is when are you filming? Is it everybody stays after school kind of a thing, or like how do you how do you fit this into the day?
If it was staff related, then yes, we do wait until the end of the day. Obviously, nothing interferes with patient care. Some videos I involve my friends in, so depending on the time available, we probably do it on weekends, Saturday or even Sunday. So it's been nice to find people who share the creative aspect of it and they're willing to take time out of their busy schedules to do it. If it's sometimes with staff, if I have to involve more than 2-3 people, we'll get lunch. I'll get lunch for the office. Kind of, you have to give a little bit of incentive. Why am I staying after 5 o'clock for your video?
to build up your Instagram page.
Correct.
Right. TikTok page.
Yeah, exactly. Like, what am I getting out of it? But again, it's all about the culture and the fun. I mean, it's more fun for them.
I love the kind of the morale building aspect of it.
Yeah, it's like you get to play together, in addition to working together. That's really cool.
Yeah. And what is your feedback about just like dentists in general? Like, okay, maybe we should do this now. Let's do this now.
Uh-oh. What is it?
Well, no, we've been talking about one of the reasons why it's so like we haven't had a dentist on is because I'm terrified.
You're an anti-dentite.
I'm not an anti-dentite. I'm pro-dentist. I'm as like a professional, like as an ophthalmologist, I appreciate dentists. Mm-hmm. I've actually worked in the OR with dentists on like facial trauma things.
There you go. Okay.
But it's as a patient. Mm-hmm. I'm 9 months overdue. Okay.
Ooh, okay.
It's bad. I'm afraid of the dentist. And not so much that I need to like medicate before coming in.
You would probably benefit though if you did that.
Maybe I don't know.
Right now you're white knuckling it.
There's something about teeth. I'm feeling tense already. I just sit there when I'm in the chair, and you guys are like doing the scraping and the water and the thing. Like I'm holding on for dear life, and I'm sure there are a lot of people like me out there.
Oh yeah, stand in line. I mean. You and pretty much 90% of people that I see. It's not easy. It's not easy.
But then I've got an unpopular opinion.
She falls asleep.
I love the dentist. My dentist has a chair that is, heated and massage. And they give you the little remote and you just turn it on.
Doesn't help me.
And then you lay back and they give you the sunglasses so it's a little darker red.
Yeah.
And then
do you guys go to the same dentist? Because you guys have very opposite experiences.
We do.
Like, maybe he goes somewhere else.
And then when they're scraping, I'm like, yeah, get all that off of there.
Yeah.
The water, I just love it. It's like a little vacation, right? I lay back and people like attend to me and they don't need anything from me. And I get to just lay there in my heated massage chair for 30 minutes or an hour.
So what I'm hearing from you, Dr. Humie, is that I'm more common and she is less common.
I'm the weirdo.
I would say you used to be more common. She's becoming more common now because a lot of what you guys experience now is related to previous, history of your dental visits, previous trauma. So that was what I was going to ask is as far as...
no.
Kristen, I mean, how was your experience growing up going to the dentist? Did you have...
I have had so much surgery.
Okay.
This isn't going to help your case.
Oh, no.
He's had nothing. Well, you've had one finally. No. You did have one procedure a few years ago that I remember. But as a kid growing up and even as an adult, I have continued to have so many surgeries. I don't know how far you want to get into it, but I had 3 baby teeth that never came out. And so when I was in high school, they had to pull them out and then put braces on and then do this horrific, barbaric sounding surgery that involved peeling back the roof of my mouth to put I don't know what they were, but they had to attach the braces with a chain to the teeth that were in my jaw still. And then it pulled them down. But one of them got stuck halfway because once you're a certain age, right, it fuses to your jawbone or something. So one of them didn't come all the way down.
Oh my gosh.
So we had to take that one out and then put in an implant. And so all of that was 5 years, many surgeries, And then I don't know, just a few years ago. Well, no, I had another.
It makes sense to me because you've had all that crazy stuff happen.
So cleaning is
so cleaning is no big deal.
100%. It's almost like it's not unknown anymore. People I think are nervous and scared of what they don't know or don't understand. But in your case, having been to the dentist many times and had gotten the work, you're kind of like, okay, I know what to expect. I think a lot of the anxiety comes from coming in and not knowing what to expect and not knowing what the dentist is about to tell me. And, oh my God, how many cavities am I going to have? Is he going to need to do this? So yeah, it's not easy. And I tell patients all the time, I don't like doing what I'm doing to you either, but it's got to be done. I'm not the bad guy here. I'm trying to help.
Do you ever say, this hurts me more than you?
I mean,
that's what my parents used to say when they had to punish me.
I say it, just not like this tone, but I do say it. Yeah, I say it, especially when I give anesthesia, because everyone's complaining about the shot, and I'm like, look, I don't like giving it either. But we either do
that
this?
Is the one part of the dentist that I don't like.
Yeah. I mean, we either do it, or you're gonna have to feel
the alternative.
Everything. Yeah. What's the alternative, right? But I will say dentistry is changing with time. I mean, like right now with local anesthetic, we do use a specific buffering solution that helps reduce the acidity of the anesthetic. So when you inject, it doesn't hurt as much. It takes away that pinch feeling. A lot of distraction.
I always thought that was just from the needle. Is it not?
It's the needle pinch, but then the anesthetic itself, the pH of it is low. So when you inject it, it kind of creates that very, painful experience. So
yeah, like you feel it going in.
That makes a big difference because I remember I was a resident one time at the VA, and I had to do a blepharoplasty, and the pH, I guess the buffering solution wasn't correct, and so the patient had a significant amount of pain. Everything went okay, but it was like out of the ordinary, and so it really does make a difference, like what he's talking about in terms of what you're drawing up the anesthetic with. Yeah.
Huh.
So
but it's you have the sound of the drill. I think the mouth is such a personal space, and actually for me, it's the eyes. So you and I both, buddy.
Me too.
You and I both. See, you're not gonna like coming to me. I probably won't like coming to see you. It's such a small personal space. Anytime I get my eyes checked, which is not often, by the way, I have to say, right away my eyes just start tearing up, and it's like, and the guy's like, I haven't even started. I haven't touched you. I'm like, I know, it's just very. That
must be it. It must be I like how you put that, the personal space to it, because like you're not used to people. Like you give people hugs, you get like other parts of your body. You're like used to people being a little bit closer to you, but not your eyes, in your face, in your mouth. Yeah.
Well, and your eyes in particular, like you have reflexes to keep people from getting in there, right?
Sure.
Like at least your mouth, you don't have that aspect to it, but like your eyes are wired to be like,
I don't know,
no, stay away.
I would close my mouth if someone tried to put their fingers in my mouth. I think my reflex would be to close my mouth. I would not want that, but maybe that's just me.
If they're coming at you with fingers, maybe.
Yes.
Although I don't know, I've had toddlers. You've had toddlers. You get used to it.
Yeah.
So I'm guessing you've had a lot of practice in like talking people off the ledge kind of thing. Like,
oh my gosh, we always joke around in dentistry. In dentistry specifically, you have to be both a dentist and a psychologist in a way, because it's not necessarily about doing the dental work itself, but it's calming the patient down, reducing their anxiety, connecting with them. That part, obviously the connection with the patient, that goes with every field, but really taking the time to making them feel comfortable and gain their trust before you work in their mouth. So it's very important.
So one thing that we see a lot in ophthalmology, I'm loving like seeing the overlaps between our fields here, but one thing is we do have a lot of people have vasovagal episodes. It probably it's not really often. It's a particular demographic, usually young adult males. Whenever you come to try to get like a piece of metal out of their eye or something, or just even come and like bring the microscope to their eye, they will have a vasovagal episode and pass out. Do you get that? Is there a similar thing with dentistry?
Yeah, a lot of times with the anesthetic, I think because people are just so, the white knuckle, like you said, once you get the anesthetic and you seat the patient up, you have a few cases where they just pass out and they're like,
gotta pass out.
So sorry, I'm just not used to it. You get this sudden.
They always apologize as if it's their fault. It's like, no, you don't have to apologize. It's okay.
Exactly. I think because they put so much pressure on themselves to try to be a good patient.
Yeah.
And so
that's true.
It's kind of like a reflex, like you said, when you pass out, you feel guilty, like, okay, I disappointed my dentist. But at the end of the day, you have to understand, it's not a pleasant experience. My goal always with my patients is, let's make this as quick, pain-free as we can and just move on with our day. Everyone knows it's not a pleasant experience. So let's just kind of get it out of the way in the most comfortable way possible.
Yeah. Is there a gender difference in those responses, though? Do you see that too?
What do you mean?
Because you said it's usually young men.
It's almost always young adult men. They're the ones that are going to pass out.
That's interesting.
Yeah. I will say.
What is that about?
From my experience, it's always been men, surprisingly. Yeah. Wow. That's so
something
true
about it.
Men just have.
I wonder what that's about.
Lower pain tolerance, I guess.
I mean, women do.
I think there might be something to that, honestly.
I don't know if it's like a biological difference, but just in daily life, like there's a lot of pain involved in being a woman, right? Like uncomfortable shoes, we do these beauty procedures to ourselves that hurt. We have children, that really hurts.
The waxing.
Pregnancies, right? Like you just sort of get used to being in pain.
I'm gonna need.
Oh yeah.
I'm gonna need. I do not do well with my waxing. No,
okay.
He passes out every time.
Oh man,
wouldn't go near the stuff. But I think we need a trial. We need a clinical trial looking at this. I need. Actually, you probably couldn't do something like where you're trying to make someone have a vasovagal. So
I don't know that the IRB would approve that.
I don't think
but
if
anybody knows. If there's like a reason for this, I'm curious.
Well, we gotta get you. We gotta get you out of that. Once I know in February you're coming to Atlanta, right?
I am. Yes.
So let's come on by, and we'll try to change the experience for you.
Yeah. You got to go to the dentist, and then you can come to Portland, and he can give you an eye exam.
Oh yes.
Let's do a swap.
I like that.
That's good. That's good. Well, one thing I love that you're doing, because I can feel it watching your videos. It's like you're kind of demystifying dentistry a little bit, right? You're showing that dentists are just regular people. They're not here to try to hurt you with a giant drill and needle. And is that part of the motivation for doing these videos, or?
Yeah, 100%. I mean, when you go to any healthcare provider, whether it's a dentist or physician, I think the environment itself, like we agreed on, it's very unpleasant, and so you have this authoritative figure that's about to do something to your body. It's scary. So I think one thing that I love about doing these videos is that you're humanizing the dentist a little bit and creating a bridge between the dentist and patients, not just the dentist and his staff or the people that they work with. The biggest compliment that I get is when a patient walks into the waiting area and it's like, "Oh my God, I love you guys. I feel like I know you. I feel like I've been here before," even though this is their first appointment, and they've seen us on social media. It's so rewarding to be able to take that bridge and just make the connection much quicker. So when patients feel like they know you, they know your personality, they've seen your staff, it becomes a more comfortable experience for the patient. It's like, okay, I can kind of relax a little bit.
Nice. I love that. Yeah. Let's take a quick break.
Okay.
We'll come right back. Hey, Kristen.
What's up?
It'd be great to have
$1 million.
Sure, but also a little bit of disability insurance.
That would be.
We kind of dropped the ball on that.
Yeah, both of them, because you got testicular cancer twice and then had a cardiac arrest. And now you're basically uninsurable, but I love you anyway.
Yeah, it does make it a bit harder. And disability insurance is something that every physician needs to have.
It's true.
Because our job, our bodies and our ability to move our bodies are so important to the work we do.
That's right.
Well, let me tell you about Pearson Ravitz.
Tell me.
Yeah, this is a company founded by a physician, Dr. Stephanie Pearson, a disabled OBGYN who has now dedicated her career to helping physicians avoid similar oversight to, us.
Very important work.
Exactly. She's helped over 6,000 physicians get disability insurance. To find out more and get a free one-to-one consultation, go to Pearson Ravitz. That's PearsonRavitz.com/knockknock. Again, that's www.pearsonravitz.com/knockknock to get more information and protect your biggest investment, you. All right, we're back with Dr. Humie. So I have a very important question. Have you seen my portrayal of dentists in my content?
Oh, yeah. Yes.
Okay.
You have two, if I'm not mistaken, you have two videos, right? One about fluoride and one about dental insurance.
Yes.
Those are the two that I found. Yeah. Am I right?
Yes, I did. There was another one featuring the orthopedic surgeon who started to try to teach med students about teeth, only to be confronted by the dental mafia, who told him he better stay away from teeth. And by the way, you also have a bit of gum recession. And that dentist that confronted him with a golf club turned out to be the fifth dentist.
Ooh, you always have the golf club guy in all your videos. I love it. He's like the villain, right? In all your videos.
That's the dentist.
That's the dentist.
Oh my gosh.
That's the. So
because I've seen the golf club
it's because of his feelings.
Yeah, I've seen him in other non-dental videos. I thought, but I guess he made his way through, huh?
No. That is the dentist. Yes, that's my dental costume. Is the golfing.
So, I have to say, you are so creative with your scripts. I mean, I want to ask you how you come up with your scripts, because like you said, I think writing this stuff is, for me, the hardest stuff. Like all the production, all the editing, to me, that's the easiest thing for me. But I think coming up with the scripts, I'm also interested to know how you do it.
Well, for me, usually I'll find a core conflict. Like for that one I was just describing, I was like, wouldn't it be funny if, because teeth, they're not like bones in the general sense of like orthopedic surgery.
They're luxury bones.
Taken care of. Or they're luxury bones, right? Exactly. And so I was like, well, wouldn't it be funny if ortho, which is like, it started talking about teeth, and then the dentist got mad. Mm-hmm. And so I have a central conflict like that, and then I'll just build jokes around it. And I've been writing jokes for, I have a background in stand-up comedy. I've done like satire writing for a long time. Yeah, so I'm generally fairly good at writing material, and so once I have the core theme, I'll just kind of build it out, and before long, it's honestly like 2 minutes.
If you and I joined forces, and you had material, and I had all the production stuff, and we just combined them into a show, oh my God, we would kill it. I really think we would kill it.
Yeah, and eyes and teeth.
There's something there, right? People hate eyes and teeth, so
yeah.
I think of both of you, it's like, why do you want to do that for a living? Like, why do you want to be in squishy eyeballs, and why do you want to be in people's mouths all the time? Like the lay person, just that's baffling to me.
What did get you into dentistry?
Yeah, I mean, I grew up with healthcare providers in my family, everywhere, and all around the world. I had family in Germany who were surgeons and dentists. Dentists and doctors here in the US. So I kind of did what any curious college student would do, just kind of shadowed both. And during that time, I was taking a lot of art classes for some reason in college, because I was just exploring all the creative aspects of my personality, and I was into ceramics and all that stuff. So dentistry just clicked for me, honestly. It was the perfect combination between art and science in a way. And being able to give someone immediate relief when they walk into your clinic, or immediate smile results, smile makeover, was just very satisfying. My shadowing experience was really, really positive. So that's, I decided to apply.
Now, as you know, all of us in healthcare, we always have experiences that humble us and things that have our trials along the way and learning our field. And so you told us about a story of a patient using super glue at home
oh my gosh,
to cement a bridge. So tell us, I haven't heard a lot of like dentistry stories regarding patients. So can you tell us about this one?
Yeah, it was actually a 21-year-old patient. She had.
I'm gonna guess this was a man.
No, it was actually a female. Yeah, it was female.
Wow. Look at that. Yeah. All right.
Yeah, okay. We're not all bad.
Yeah,
all
we're not all bad.
I'm not saying you're bad. I'm just,
we may have very low pain tolerance, but we're not. But yeah, she had a bridge, from canine to canine, and this is a patient that I've been seeing for a while. The bridge came off, I guess, on a weekend, and she couldn't find any dentist in her area to see. And in my previous clinic, we happened not to work any Saturdays. Now, thankfully, we open 2 Saturdays a month. But she came to me a couple of days later, and she was like, actually, she came in for a regular checkup. And I'm looking at her teeth, and I just see this almost like clear, sticky stuff around her bridge, around her gums. Her gums are super inflamed. I'm like, what happened? And she told me, she was like, yeah, came off during the weekend. I didn't know what to do, so I just glued it. And I was like, you glued it with temporary cement, right? And she's like, nope. I had super glue in my drawer, and I just put it in.
Gorilla
so this
glue.
Poor girl. I mean, I had to cut the entire bridge out. We had to drill it out. I mean, once you use super glue, it's the end. So the moral of the story: do not use super glue. Go to a pharmacy if something like that happens. They have a specific dental cement that you can use. You can put it back on until you see your dentist.
Okay, what is that called? Because that is good to know.
They have different brands. I can't recall the exact.
Just the teeth cement.
It's called temporary cement.
Just ask for teeth cement.
Dental.
Yeah. Okay.
See, this is another thing we have in common in ophthalmology, because I have
eye cement?
No, I have people that mistake super glue bottles for eye drop bottles.
Yeah.
And so they will, because they're kind of, some patients can't see very well, or they're using them in the dark in the middle of the night. And so they grab, for some reason, they keep their artificial tears in the same drawer as their super glue.
Oh, no.
And grab the wrong bottle and put it in their eye.
Has that actually happened?
What do you do for that?
Oh, yeah. Most of these patients end up coming into the emergency department, obviously. And so we'll get a call about it. It sounds really awful. It sounds like it's a worse situation in dentistry than it is in ophthalmology, because the glue doesn't cause any permanent damage. It just glues the eyelid shut at the lashes. So you just trim the lashes, the eyelashes, and the eye will usually open up. But it's always a really terrifying experience.
Get stuck on the actual eye itself, on the eyeball?
Some of it does, but it comes off and kind of gets washed out pretty easily. Yeah,
because your eyes are pretty wet, right? Like more so than your mouth is pretty wet too, though.
I wake up with some dry mouth from time to time. So
xylitol. I know why that is.
Xylitol gum.
Xylitol. There you go. Xylitol gum. Yeah. Because I'm always talking in ophthalmology about over the counter, like what to use, what not to use. So what are the things that you would tell people like this is garbage? Like, don't use this over the counter stuff that you find.
Look, there's a lot of brands out there with, as far as toothpaste, mouthwash. The main thing that you want, which is something that you've talked about, is a fluoride toothpaste, because fluoride is good. Okay, we all agree on this, right?
I would love for all of us to agree on this, and I'm glad you brought that up. Because I mean, whenever you see fluoride coming back into the news, because I feel like this happens every so often, right? All of a sudden, people start talking about fluoride.
Why is it such a big deal? I don't understand.
I don't know. I think the neurotoxic effects of like high doses of fluoride get blown out of proportion.
And aren't those studies like in mice? Like, we don't even know if that is
right. But I mean, anything in excess amounts can cause neurotoxicity. Like water in excess
you can die
amounts
from water.
Can cause neurotoxicity.
Yes.
So,
you guys have a friend behind you.
Yeah, this is Milo.
Yeah.
Usually he doesn't bark in here.
Oh,
hey, buddy,
making a little cameo.
No, I love it. I've actually been wanting to get a dog, but I don't think I would be a good dog dad, to be honest with you. I'm out of the house a lot, and
they need the attention. We have people around that give him plenty of love.
But to answer your question, it's mainly the ingredient. You just look at the ingredients. I mean, you want something with fluoride. Every case is different. If you're a patient who experiences a lot of sensitivity on their teeth, I'll recommend something like Sensodyne. It has a specific ingredient for tooth sensitivity. If you have dry mouth, I'll recommend xylitol. So, case by case, I don't necessarily recommend like a specific, brand, because every office is going to recommend something different. I mean, they all have, I'm sure, like eye products, they all have a lot in common.
Yeah.
So it just depends on the case.
But fluoride good. Fluoride good.
I wonder if there's a dental equivalent of Visine, right? Which is not about the brand, but about the ingredient. Like you're saying.
Yeah.
Like, is there a dental equivalent of?
So you have Visine. I tell people not to use Visine because it has astringent. It's got tetrahydrozoline that constricts blood vessels and causes problems. That's why people use it for like get the red out type drops. But it's bad. It's bad for your eyes.
It doesn't actually solve the problem. It just makes the problem worse. And temporarily gets rid of the symptom.
Also, just homeopathic stuff.
Yeah.
Like there's lots of homeopathic things. It's like just putting like tap water in your eyes. And so I'm sure if you get into like homeopathic toothpaste and things, it probably doesn't have the type of ingredients that you need to like adequately clean your teeth.
Yeah, it's different. How is the product market for ophthalmology? I mean, is it a saturated market? Do you guys have a ton of products, or not as much as you see, I guess, with dentistry?
No, there's a lot. Just go to the eye drop aisle, and it's all over the place. Yeah, I mean, most of them are okay, but then you get the redness relievers, the homeopathic stuff. That's not good. But people buy it because they get scared about certain things because of somebody on TikTok that told them to to avoid certain things.
Yeah.
And I don't know. It's like the fighting misinformation. Like fluoride's bad, right? It's that kind of thing is always a struggle.
Yeah, you gotta always do your research. Always do your research. One thing that I was watching one of your interviews, I think it was with Dr. Mike, and you guys were talking about how nowadays there's just a lot of information on the internet, and really the role of a healthcare provider has changed as far as educating the patient. It's more about guiding them towards their decisions, and I really, really resonated with that. I mean, it's the same thing goes for dentistry. Yeah. People just come into our office like, I know I need a root canal. I have this and I have that. I just want to know what my options are. So this is kind of what it's like nowadays.
Well, I have one more thing for you before we wrap up. I posed a question to my audience on Twitter, X. I asked people, what's your favorite thing about teeth? What's your favorite thing about teeth? So the most common response was having them. People appreciate having teeth, which is good. Chewing was a popular, like people. Wow, I think that's more original. I think that's more mandible appreciation versus tooth appreciation. Some people talked about how that they appreciate their dentist, who's very nice and calming, and so I think you're probably having a big effect on people with how you're portraying dentists and dentistry. A lot of people say that they love the smile that you give them, literally the smile, and probably also just the smile that you put on people's faces. And it makes sense. Like looking at your smile, like I would guess you'd be a dentist.
Thank you.
Right? Yeah. Is that one of the prereqs? You have to you have to have great teeth to be a dentist, or like they give you a certain amount of time.
Believe it or not, patients have actually asked me to remove my mask so they can see my teeth. Like this happens
to make sure that you're.
This
they
happens
want some
very
proof
often.
that you're any good.
Yeah. And I'm always feeling like self-conscious sometimes. Like, is this good enough for you? I don't know. I think I have good teeth.
So they weren't all wholesome answers. One said, I like that they have a gooey center, like a weird crunchy gusher.
Ew. Gosh.
Okay. I don't even know what that means.
That's something. Well,
like the pulp inside, I guess.
One person said they're great for biting my fingernails.
Oof.
Ew.
Wow.
That's probably not good for your teeth, right?
No.
Do you counsel people to avoid probably just biting things in general?
Yeah, we always say your
biting.
teeth are not tools. They are not tools.
But hold on, but they are for biting.
Well, yeah, but food.
They're for biting. Yeah. I mean, okay, look, nails, I guess, are not as bad as opening beer bottles, but still.
Sure.
Yeah. Preferably not.
So, some people just started asking questions. Why are some teeth yellow? Like, I don't know. But then I followed it up with a question that I'd love to know your opinion. I asked people, what is the best tooth? And I gave 4 options, the 4 main types of teeth: incisors, canines, premolars, and molars. What do you think came in first place? So far, there have been over 1,000 votes.
Incisors, canines, and then what? You said what? Premolars?
Premolars
or molars?
And molars.
What do I think came first?
What do you think people said? What do you think people said is the best tooth out of those 4? If you had to guess.
I would probably guess incisors because people appreciate a smile more than function, probably.
Canines. Canines has over 50% of the vote so far, which I think is just because people like dogs. I think that's probably honestly the reason. I don't know if people really understand the difference between incisors and canines. Canines are the bigger teeth, right?
The
sharper ones.
Yeah.
For tearing.
Canons actually have the longest roots in your mouth. So I mean, they are the stronger teeth. Obviously not as strong as the molars for chewing, but they have the longest roots. So we always say, if you want to try to save a tooth, always try to save your canine.
Okay.
They have smart. The most personality too, I feel like.
Canines?
Right? Like
yeah, they stand
people
out. People
have different looking canines. Yeah.
Correct.
Yeah.
So your front 2 teeth, those are incisors?
Yeah, incisors.
Those would be
here. All of those are incisors.
Yeah. Everything around the canines, basically.
Yeah. And then one person who I'm kind of worried about said, teeth remind me of my own mortality, because when you lose them, they're gone forever.
Wow, that is very dark. That just got really
dark. Also kind of insightful. Like, that's true, and that's probably a good way to think about your teeth. Is that you want to protect them because when they're gone, they're gone.
Same as eyeballs.
We're not. I think that's maybe the next frontier in dentistry is how can we get shark teeth that just keep growing throughout your life?
Regenerate.
I know. Thank God for implants, right? I mean, if you do lose your teeth, you have a lot of options. Not that I'm saying don't take care of your teeth, but I'm just giving hope for people. It is not. People have options nowadays. Thanks to implants and implant retained dentures.
I mean,
poster child for implants right here. How many implants?
In fact, I think one of my canines is an implant. Yeah.
Yeah.
Well, you both have beautiful smiles, and you're rocking the smiles. So keep smiling.
Thank you. I paid a lot of money for mine.
Yeah.
Or my parents did.
Yeah.
Well, awesome. Well, thank you so much for joining it. Tell people where to find you on social media.
Yeah. My handle is Dr Humie at Dr Humie, both on Instagram and TikTok. I have not made my way on YouTube yet, but maybe one day.
I think
I feel like you are ripe for YouTube because of the production quality. Like that is.
So they really do appreciate production.
YouTube just obviously came out with the shorts. I don't know how the shorts are doing. I mean, I think YouTube, I've always thought of it as the long form videos, which in my opinion take way longer to make than our 1 to 2 minute production videos. I will say I don't consider myself as a dentist that is I love educating people, but I think my content is very specific to a comedic approach of the relationship between dentists and patients, dentists and staff. So I think YouTube, there's a lot of dentists out there that are doing a lot of educational stuff, which I love. I'm happy that there are dentists out there. It's just, I think my content is a bit different.
Yeah. Can I just give you a little like piece of advice?
Please. Yes.
Just post it. Just have a YouTube channel. Yeah. Even if it's just shorts, you have nothing to lose. And you can find a way to do it very efficiently and easily. And there is a distinct audience between TikTok and YouTube, and people that just watch YouTube shorts. So even if it's just shorts, get it out there. And it's it really, there's no downside to it. So I love that. Because I was just like, your thought process was just like me. I was like I'm already, I'm on these 2 or 3 platforms, and like I'm good. I'm happy with how things are going. And then eventually someone started stealing my content and posting it on other platforms. And wow. You want to, especially as your audience gets larger, you want to have a presence. Even if you don't do a lot of posting, you want to have your stuff on those platforms.
You want to claim your own
so
stuff.
That you can claim your own. I'm not saying someone's going to steal your content. Hopefully not. But just in case, it's good to have a presence.
No, I love that. Actually, thank you for that advice. So, I will take it, because at the end of the day, the video is made. So you're right. It doesn't hurt to just share it on other platforms. Do you do any long form content on YouTube?
Just the podcast.
Okay,
that's it. Yeah, I don't know. I can't write longer than like 3-minute skits. I mean, I could, but
I mean, is it a skit anymore? If it's right, like, isn't that one of the features of a skit? Is it's really quick?
Yeah. I mean, it could be a little bit longer. I think what YouTube has told me in the past is like the optimal length for YouTube video is about 7 or 8 minutes.
Okay.
So, and that's, I don't know. That seems like a long time for like a skit.
I agree.
Where I'm playing all the characters.
Yeah.
I don't know. Like, eventually people will get tired of seeing my face. I guarantee it. So, and that threshold is about 2.5 minutes.
Well, I think with your funny scripts, that's not true. I think you're gonna.
Thank you.
Yeah, stay relevant for a long time.
Please keep doing what you're doing. I love seeing your content and the creativity, and everybody should go check it out. Dr. Humie on Instagram and TikTok. Awesome stuff. So thanks for coming on the podcast.
Thank you. It was really a pleasure being here. Thank you.
Hey, Kristen.
What?
You know what mites do when they get excited?
What?
They dance. They dance. They dance all over your face. You got these on your eyelids. You know that, right?
I do not.
Well, some people do.
Okay.
They're Demodex mites.
Yes.
They cause blefaritis, which is like red, itchy, irritated eyelids, like flakiness. Just you want to scratch your eyes, and don't do that, by the way. But yeah, sometimes that's from disease.
Demodex dance.
It's the Demodex dance on the eyelids, except it's not that fun because it gives you all those symptoms. All right. So yeah, but they're cute, right? They're not. Yeah. They're not gross.
These ones are these stuffy versions.
Right. Oh, the real ones, not so much.
Are the real ones gross in the microscope?
They're still. I think they're still cute, but again, I'm an ophthalmologist.
Yeah.
But don't get freaked out by this.
Okay.
Get checked out.
All right.
All right. You go find out more. Go to eyelidcheck.com. Again, that's EYELID check.com to get more information about Demodex and Demodex Blefaritis. I survived our talk with a dentist, and I even survived hearing about a dentist patient.
Yeah,
I was a little nervous about
story.
That part. Yes, yeah. I was a little nervous about that part, but got through it.
You did it. Now you know how I feel when you're talking about eyeballs.
That's true.
Yeah.
I just have so much appreciation for like funny medical content creators.
Yeah.
It's to use the expertise to make something funny and humanize people that see patients. It's so great.
Also, there's a lot of stuff in healthcare and dentistry included that is just absurd and ridiculous and funny, and
Yeah.
why not be able to?
I'm shocked that he's doing his videos just with an iPhone. Like, it looks so much better than my videos.
Well, you said it, not me. I feel like this is a trap. I don't know what to say here.
No, it's fine. It's fine. No, I know it. I know. I know it. I know it's like just very low quality. But you know what? It is what it is. I'm not going to change now. I'm too old to change. It's part of my charm. Let's call it that.
Yeah.
How about? Well, let us know what you guys think. Are there any other dentists out there we should talk to? I feel like I'm okay. I can do dentistry.
Okay, it's like exposure therapy.
It is. It's
pretty soon. You'll be able to go to the dentist again.
Give us some suggestions. You can email us knockknockhi@human-content.com. Visit us on our social media platforms. You can hang out with us in our Human Content Podcast family on Instagram and TikTok at Human Content Pods. Got some great new podcasts on the Human Content Podcast Network. Also, thanks.
That was aggressive.
Oh, it's a wonderful network. Thanks to all the great listeners leaving feedback and reviews. We love those reviews. If you subscribe and comment on your favorite podcasting app or on YouTube, our YouTube channel, by the way, at Glaucomfleckens, we can give you a shout out. Like today, user Zonular Apparatus, this is on Apple, said, "You questioned whether we like to hear your bizarre optho terms. I was listening today, and you said the words Zonular Apparatus. To which I loudly proclaimed, now that is just completely made up." I asked my husband, an ER doctor, who thinks he maybe learned that in his optho rotation and promptly forgot because I knew I would never need that info again.
Probably
fair.
True.
Yeah. You didn't need it in the first place. But I'm glad you like it. I love hearing these weird terms used in eyeball world. Your podcast is great for down and dirty eye learning, and we plebeians trying to not make people go blind. I appreciate that. That's good. Talking about the knockknockhi episodes.
Yeah.
We have full video episodes up every week on our YouTube channel at Glaucomfleckens. Tons of cool perks over on Patreon. Check that out. Bonus episodes, react to medical shows and movies. Hang out with other members of the community and us. We're always there. We're doing live streams. We're doing like Q&A. We post things and try to get feedback
bonus
from people.
Bonus content, behind the scenes stuff.
Yeah, exactly. Patreon.com/Glaucomflecken or go to Glaucomflecken.com. Speaking of Patreon community perks, new member shout out. All right, we got Kushal K, Brendan B, Dr. Hoover, Kyle B, and Melanie.
Hello.
Thank you all for joining. Shout out, as always, to the Jonathans, Patrick, Lucia C, Sharon S, Edward K, Stephen G, Marion W, Mr. Granddaddy, Caitlin C, Brianna L, Mary H, KL, Keith G, Jeremiah H, Parker, Muhammad L, David H times2, Kaylee A, Gabe, Gary M, Eric B, Marlene S, Scott M, Kelsey M, Dr. Hoover, Bubbly Salt, and R.I.P. Pink Macho.
No, she didn't die. I hope not. I don't think she did.
Oh.
But she is gone.
Oh.
And we miss her.
Yeah. What should I say then? I think RIP from a Patreon standpoint.
Sure. RIP Patreon.
Milo wanted to participate in the naming of the Jonathans.
He did. He had a lot to say about it.
He did have a lot to say. But anyway, Bubbly Salt. Bubbly Salt's still here. Pink Macho. In our you know how we have a community, Patreon community.
Uh-huh.
We also have a cemetery.
Oh.
In our little Patreon community where we pay homage to the people that have departed us over the years.
It's true.
So anyway, R.I.P. Pink Macho. Thank you all for listening. Patreon Roulette. I forgot Patreon Roulette. Shout out to Sarah T for being a patron. Thank you, Sarah T. And thank you all for listening. We're your hosts, Will and Kristen Flannery, also known as the Glaucomfleckens. Special thanks to our guest, dentist, Dr. Humie. Our executive producers are Will Flannery, Kristen Flannery, Aaron Cordy, Rob Goldman, and Shanti Brook. Editor and engineer Jason Portiz. Our music is by Omer Ben-Zvi. To learn about knockknockhi's program disclaimer, ethics policy, submission verification, licensing terms, and HIPAA release terms, go to Glaucomflecken.com. Milo really loves those HIPAA release terms.
Mm-hmm. Gets excited.
He's a big fan of this outro. Go to Glaucomflecken.com or reach out to us at knockknockhi@human-content.com with any questions, concerns. If you want to send us some fun medical puns, we'd love that too, kind of. Knockknockhi is a human content production.
Knock, knock, goodbye.
Hey, Kristen.
Yeah.
What do you think about clinical documentation?
Boo. do.
You feel that strongly about it?
I do.
Why?
Because your doctor ends up spending all their time typing little notes on their little computer instead of like listening to you or looking at you in the eyeballs.
Well, it sounds like your doctors could use DAX Copilot.
I bet they could.
Yeah, this is like a little Jonathan in your pocket.
Yeah.
It's an AI assistant that helps decrease the administrative burden that leads to burnout and leads to like your doctors not being able to look at you while they're talking to you.
Yeah, it helps them do their little typing and take their little notes without having to do it themselves.
93% of patients say their physician is more personable and conversational with DAX Copilot. You love conversation.
I do, and I want them to be a person.
And that we need that because today's physicians are overwhelmed and burdened and they feel like work-life balance is unattainable.
That's right.
And we know that work-life balance makes you a better physician.
That's right.
To learn about how DAX Copilot can help you reduce burnout and restore the joy of practicing medicine, visit aka.ms/knockknockhi. Again, that's aka.ms/knockknockhi. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.